Radial tear of the inferior lamina is an unusual pattern of complex meniscus tear where one of the two flaps, that is the inferior and the superior, so the inferior flap of the medial meniscus has got a radial tear, and this is a bad pattern because it decreases the hoop stresses of the meniscus significantly, and because of the radial tear the load transmission comes directly from the femur to the tibia. So here we can see that there is a radial tear of the inferior lamina of the medial meniscus, thereby leading to a mucoid degeneration kind of a tissue on the inferior surface of the meniscus. So it is important to identify this pattern. Most of the times these tears are labeled as a complex tears of the medial meniscus and treated with meniscectomy, which is not the right thing to do, because if you do a meniscectomy you will lose the important hoop stress and the patient will develop an accelerated onset of the arthritis. So it is very important to identify the exact pattern of the injury and to identify whether the patient is having an undersurface radial tear, because a radial tear of even a single flap of the meniscus is equivalent to a meniscectomy. So here we have identified the inferior tear, we are just preparing it, and then it is good to repair it in a fashion so that the sideways repair is possible. So we want to do a sideways repair of the meniscus. So what we do in this scenario is either we can use a box stitch technique, or we can use an anchor with a side to side margin convergence equivalent repair. So we make a high anteromedial portal, and with that we insert a extrusion repair anchor. Now this is a special anchor, this is an all suture anchor. It is customized for this particular sort of repair. The thread diameter is very low, so it is a number 0 UHMWPE fibers, and once the anchor is inserted we can use the suture shuttling devices to pass the sutures through both the laminas. The anterior lamina can be addressed through suture shuttling devices like ideal suture shuttle device, and you pass a chia onto that, and this chia can be railroaded over the anterior thread. So what we will do is we will pass two sutures anteriorly, and then we will be passing two sutures posteriorly. It is important to include the inferior lamina. For the posterior lamina, it is good that we use suture passing devices like a knee scorpion. And in the end, when we are done, we will be tying the two sutures anterior and posterior in a side to side fashion. So here we have flipped the portals and then we are closing it. So now we can appreciate that we are doing a side to side closure of the meniscus area, and this will lead to a very good closure of the inferior lamina radial tear. So in spite being a complex pattern tear, the radial component is the component which is the most important to assess, and once we are able to close it properly, we will be able to reconstruct the hoop stresses of the patient, and in the end, if it is needed, we can do a side to side closure. So in this particular case we are using a all inside repair AIR device from Stryker and doing the in the end the margin convergence from an air device, which will be a third suture which will be closing the radial component of the tear, and this will lead to a good weight bearing capacity or the hoop stress loading capacity of the meniscus per se. So this is an important pattern of tear which we should identify and repair. Thank you.